Hello and welcome to Medicine with Dr. Moran. I'm Dr. Keith Moran, and this video is the 10 ways to fix bloating. One of the common things that I see in my office are complaints about gas and bloating. This is a problem that can often easily be solved by taking a look at what you eat and drink, as often there's something in the diet that's actually what's causing your symptoms. A number of medical conditions, of course, can cause excessive gas productions as well. So if you do suffer from gas and bloating, please consult your healthcare provider to make sure that you're not dealing with a serious underlying condition. This video is to help patients to improve their symptoms after medical conditions have been excluded. Now, the first fix is to reduce the amount of air entering the stomach. Sources of gas within the stomach and intestine are primarily from two different areas. One is gas that's ingested, for example, air that's swallowed into the stomach. And the second source, of course, is gas that's produced by bacteria in the colon. Air swallowing. The major source of gas within the stomach actually is air that's simply swallowed. It's quite normal to swallow small amounts of air when one's eating or drinking, or when swallowing saliva. Much larger amounts can be swallowed if food is eaten rapidly. Smoking or chewing gum also will cause air to be swallowed. Gulping liquids and, of course, drinking carbonated beverages are other causes. Most of this air, of course, is eliminated by burping. Swallowing air can be an unconscious process that can occur in anxious people. Some of the air, though, can go into the small intestine and ultimately will get passed out through the anus as flatulence. Most gas passed is odorless, but sulfur-containing byproducts as it goes through the intestine can be quite smelly. We've all had that experience, and it's quite embarrassing. The second tip is poorly digested carbohydrates. And as a background, there are billions of bacteria in our intestine, many of which actually promote the health of our bowel and our bodies. They survive by consuming foods that you eat. Many of the bacteria consume carbohydrates. Some carbohydrates, though, are incompletely digested, and the byproducts of that can include carbon dioxide, methane, and hydrogen. Carbohydrates which are poorly digested include lactose, which of course is the classic example everybody knows about. But there are other carbs such as fructose, sorbitol, and raffinose. This is one of my favorite cartoons from Herman. Tip number 3, lactose intolerance. Lactose intolerance affects a lot of people. Just 5 to 20% of Caucasians, but 80 to 95% of Native Americans, 50% of Hispanics, 90% of Eastern Asians, and 65 to 75% of African Americans. It's the main sugar in all dairy products. This means yogurt, cheese, milk, and ice cream. It's an ingredient in many processed foods, so look at the label if you're lactose intolerant. The problem here, of course, is difficulty digesting the lactose, as the level of lactase, which is the enzyme which digests it, is reduced in populations, as I mentioned. There are genetic abnormalities which have been shown to cause a reduction in lactase enzyme activity, and this ultimately will lead to symptoms of abdominal discomfort and distension, as well as diarrhea and flatulence. One of the things we can do to diagnose this would be a lactose breath test. In that particular test, you consume a set amount of lactose and see how much hydrogen comes out in the breath. This test has an accuracy rate of about 80%. Often clinically, we simply do a clinical trial where patients avoid lactose for 2 or 3 weeks and then return to it while keeping a diary throughout to see whether their symptoms actually improve and then relapse. The treatment, of course, if you notice that you're having problems with lactose, is simply to avoid it. There are many substitutes such as almond or soy or even other nut milks. It's important if you avoid lactose to make sure you're getting enough vitamin D and calcium. I recommend 400 to 1,000 units of D a day and 500 milligrams of calcium per day, which can be obtained through the diet if not a supplement. If you're not sure, you can always get your level checked to see whether you are in fact in the normal range for those. Now, lactase tablets can be taken with lactose to improve the symptoms. That would be the other technique that you might use if you're lactose intolerant. Tip number 4, Raffinose is another carbohydrate that may be poorly digested. Raffinose is found in beans, cabbage, cauliflower, Brussels sprouts, broccoli, and asparagus. All of these can cause gas in susceptible patients. Tip number 5. Starch and soluble fiber can be contributors to gas and bloating. These foods can be culprits. Tip number 6. Other sugars can be problematic as well. This includes sorbitol. Sorbitol is a sugar substitute that can be found in sugar-free candies. It can also be an ingredient in chewing gum. Other simple sugars such as fructose can also be a problem. Fructose is in onions, artichokes, pears, and anything with high fructose corn syrup. Tip number 7. FODMAPs refer to carbohydrates in foods which are highly fermentable and thus gas-producing. For many patients with these symptoms, a low FODMAP diet will improve symptoms. Typically, we recommend avoiding these foods for 4 weeks, and if it's helpful, then foods can slowly be added back in to see what causes symptoms. It's always helpful to keep a diary when you're making changes in your diet to try to objectively note symptoms. I have a document link in the below description which has a list of high FODMAP foods. You would thus avoid these high FODMAP foods to follow a low FODMAP diet. Please feel free to download the sheet. Tip number 8. The next one is gluten. This is a protein that's found in wheat, rye, barley, and rarely oats. The main foods that we find this in are cereals, crackers, pizza, beer, and bread. Some patients have intolerance to gluten, which can cause abdominal bloating and even gas. This can occur even without your typical findings on the blood work or biopsy tests, which we typically diagnose for gluten disease. We often consider this particular condition gluten sensitivity, meaning that someone is sensitive to gluten, but their intestinal biopsy or blood test do not show an abnormality. In this instance, a trial of gluten avoidance for 4 weeks seems reasonable. Tip number 9. As many patients have symptoms from carbohydrates, there are some patients that simply have success if they follow a low-carb diet for 3 or 4 weeks. There have been several small studies demonstrating improvement in abdominal symptoms with a low-carb diet. Generally, we recommend keeping the carbohydrate consumption low in the order of 10 to 50 grams per day. This is an area of ongoing research, and it's worth a try if you're having symptoms of gas and bloating. Tip number 10. There are other treatments. Beano is an over-the-counter preparation that contains an enzyme involved in metabolizing certain complex carbohydrates. In some patients, it can be quite effective at reducing gas production, and it occurs particularly in people who have increased gas after eating beans or other vegetables that contain raffinose. So it's something you might want to try for acute relief. Simethicone, otherwise known as Gas-X, is widely used to alleviate gas by breaking gas bubbles up. We use simethicone during our colonoscopy preparations to prevent the formation of bubbles in the colon so we can see the colon better. We also can use it during an upper GI tract endoscopy where we place a scope through the mouth into the stomach, because that will take away bubbles as well. Now, the benefit of Gas-X in patients is somewhat questionable, but I have seen a few people take this for their acute symptoms with some success. I hope you've learned a great deal about what you can do to improve symptoms of gas and bloating. Thank you for watching today. If you liked the video, please click the like button and consider subscribing. Click the bell to receive notifications, and thank you again for joining me on Medicine with Dr. Moran. Remember, get healthy and stay healthy.